Welcome to your weekly pulse of wellness. I'm your host, Tobi Adetayo, a dedicated sports physiotherapist with the passion to helping you move pain-free, healthier, and a more vibrant you. This podcast is majorly focused on physiotherapy, fitness, and nutrition. Every week, we will be bringing you science-backed strategies to helping you move better, stay stronger, and thrive every day. On this week's episode of Source of Wellness, we'll be speaking about back pain. What is back pain? How can we prevent and how can we manage back pain? Today, I have a professional, a physiotherapist, a young, vibrant physiotherapist. Miss Shion, can you please introduce yourself to our audience?
Hello, everyone. My name is James-Okwubor Oluwaseun James. I'm a MSK and sports physiotherapist. Yeah.
Right. So, Miss Shion, can you please share with us how you help patients with back pain as a physiotherapist?
So when it comes to back pain, we need to understand that back pain can be low back pain, can be upper back pain, can be the mid back pain. So when we say back pain, it's like we're generalizing it. So we need to understand that it could be any of the above I just mentioned. But basically, when it comes to assessment of either back pains that we're picking today, so today I'm not just going to be talking about a specific type, I'm going to be talking about three types. I'm not just going to focus on either the low back or about I'm talking about the three types that I just mentioned. So basically, my role is to assess the root cause of the pain because definitely there is a reason why the individual has the pain. So assess the root cause of the pain. I would assess if it is posture related, if there is muscle weakness, or if there is joint stiffness, basically. So, and also create an evidence-based treatment plan because I have the belief that any treatment you are creating or any treatment plan you're creating for a patient has to be backed, has to be evidence-based. Also, I use a combination of manual therapy. I'm a very hands-on physiotherapist. I use exercise rehabilitation a lot, and I am of the opinion that if your posture isn't right, whatever we do in physiotherapy is like we're contraindicating it when you leave. So I'm very big on posture correction. I'm big on ergonomics. Also, patient education, because sometimes I won't say I would say some physiotherapists focus on the treatment plan and how to get the client or the patients to where they are, and then we forget about patient education. I think patient education is very important. So those are like my core values. I'll teach the patient education to help people move confidently again and prevent future flare-ups because we don't want a situation whereby we're done, you feel good, and then in the future you're back again. So those are my principles basically when it comes to assessment.
All right, that's great. Thank you. From your experience, what do you think causes back pain most often? And what is it that's why is it such a common problem for so many people?
In my opinion and my experience, I think back pain mostly caused from our modern lifestyle. To be very honest, I think our modern lifestyle, prolonged sitting, poor posture, and limited movement contributes heavily to the occurrence of back pain at the moment. Like, because basically we see people on their phones 24/7 with the wrong posture, they're either slouching, they're either bending, they don't basically use the right posture. Then we have people that work so basically I've seen a lot of patients whereby when you ask them, what do you do? It's one of the questions I ask, what do you do? Like basically, what's your occupation? What's your profession? And then you see this increase in back pain amongst the bankers, the IT guys, the investment bankers, basically anyone that has to sit in front of a computer. And then you hear them say, oh, when I get engrossed, I just start working and then I forget time. So basically, you have them sitting for hours, about 9 hours, 10 hours. I've had someone tell me she sits for 12 hours in front of a computer. basically just walking without standing with the wrong posture. And then, economics also plays like a heavy part. So the table and the chair is not right. So I've had clients that their tables, their chairs, they're not economically correct. You understand? Wherever they work, you just give them a table and a chair. So posture is wrong, basically. So I think for me, it is the accumulation of stress. You understand? The common causes include muscle strain, poor core stability, disc irritation, and stress, to be very honest. So sometimes it's not just one thing, it's an accumulation of habits. You understand? It's not just, oh, I did something today and then that is it. It's an accumulation of habits. And then like slouching at a desk, lifting incorrectly, or being inactive. So the back is central to almost every movement that we make. So when it's under constant stress, pain can easily develop. Also, one of the demographics that I've noticed also are the people that lift at the gym. The the gym bodies, as we call them, the gym bodies, the gym girlies. You have them say, "Oh, I was lifting at the gym and I had a crack at my back, or I was lifting at the gym, I think I did not use the right form and then I injured myself." You understand? So I think for me, those are the common problem of so many people. Incorrect form, the posture, and just basically not paying attention to our body. Because I feel like if you pay attention to your body as well speaks to you when it's in pain. So that's it for me.
Thank you again. Moving on, what are the main signs of back pain that tell you it's time to see a physiotherapist? How do you check what is wrong?
So I know it's a general preconception that like, oh, if your back pain lasts more than days or like weeks, then you should see a physiotherapist. But in my opinion, I have this wasn't it this notion that when it comes to anything that has to do with our body, it doesn't just come. You understand? So let's say today is Sunday and then you have a back pain. And then you tell me, oh, the last time I had the back pain, I just stretched left and right and then it went. Do you understand? And then, oh, it came again like 2 days after. I stretched left and right, and then I felt better. So I feel like those are the points where we should realize that we need to see a physiotherapist. It doesn't necessarily have to be the days when or the time when oh the back pain has been there for 5 days or 10 days, if that makes sense. So sometimes, yeah, the body always gives signs of like, oh, this is coming, this is coming. It doesn't just come once, except it is trauma. It's not something that just comes once and says, oh, this thing. I've had people that said, oh, I went to the gym last week. I felt a crack in my back. And then I went home, I felt better. And then they kept on managing till after like 2 weeks. I don't think that is right. For me, I feel like the moment you notice if there is a pain at a particular point, be it your upper back, your low back, or your mid back, before it graduates to the point where it is so painful and you can barely do anything, I think we should see a physiotherapist. So basically, that's it for me. If it's limiting your daily activities, you need to say it's a good idea to see a physiotherapist. Other warning signs that I check out for, we should also check out for is pain radiating to the legs. It means that maybe when you're sitting or when you stand up, you feel pain radiating the back of your legs, the front of your legs. When there is numbness, when there is weakness, it's a good idea to see a good physiotherapist.
So basically in a short form, early detection is actually very paramount. You don't
Yes.
have to wait till it's limiting your movement or it's limiting
Mhm.
your work before your therapist. Right.
Yes.
Thank you.
Thank you.
What are the best physiotherapy techniques? Just give us briefly what like stretches and exercises that can help ease patients back pain.
Yes, so thank you. The exercises that helps, in my opinion, are it depends on the cost, to be honest, but the common techniques like core and stability exercises, like pelvic tilts, bridges, and gentle pats, they help when you're stretching tight muscles, especially the hamstrings. For the people that are not physiotherapy inclined or medically inclined, hamstrings are the muscles at the thigh, the back of your thigh, the hip flexors. and then the lower back, the muscles at the lower back. So the hip flexors are the quads, that means the muscles at the front of your thigh. So this, if you stretching out those tight muscles helps. Also, mobilization of the spine and soft tissue massage to ease stiffness. So the mobilization now, we have to stay at the grade 1 or 2 Maitland. So these are for the not medically inclined. Basically, the mobilization is not going to be like the rough. It's going to be a gentle mobilization, basically, just within the pain range. You're not going above the pain range or none of that, just within the pain range. And soft tissue massages will help also to ease the stiffness. Then education, like I said earlier, education concerning posture and economics, because movement is key. So gradual controlled exercises usually help more than complete rest. Basically, it means you don't have to be just not doing anything. You have to also be active, but not active like vigorous activities. You have to keep movement. Basically, movement is key, so you have to keep moving basically. Because I believe that when there is movement, there is increased blood flow, and when there's increased blood flow, it speeds up healing. So that's it
Nice.
for me.
Thank you for that insight.
Thank you.
So
Thank
let's
you.
just take one last question before you go. What advice
Mhm.
would you give our listeners on how to prevent back pain and keep it from getting worse?
Yeah, so when it comes to prevention of back pain, I think our posture has to be correct. So now we're talking about posture basically. So when you sit at work or you sit generally, you have to sit with support. You keep your lower back supported, your feet flat, and your shoulders relaxed. So if you're working at the office and your desk is low, your desk has to be at the heart level so that when you're typing this way, you're not bending this way, you're not slouching this way. So it has to be at the heart level. Your computer has to be raised to the eye limit in the sense that you just have to type this way, you don't have to slouch. And then your feet are flat, your shoulders are relaxed to prevent stress. Also, you have to take movement breaks every 30 to 60 minutes. I've had clients tell me, oh, we have this watch at the office, or there is a programmed timer on our laptops that enables us stand up 30 minutes, 60 minutes. I'm not saying when you stand up, you have to walk around, you have to jog or take the whole length of your office. It's as simple as just stand up, you stretch your legs, just walk around your desk, and then you have a sit back, basically. So you have to set up your work screen, as I said, to your eye level, and your chair fits your body. Basically, your chair has to hold this ergonomic chair that it helps mold your back, your neck comfortably well. So when you're at home also, you try gentle mobility exercises and you avoid staying in one position for too long, basically. So you have to, movement for me is key. You have to keep moving. You can take walks in the evening or early mornings just to make sure that you're moving. So that's it for me.
Thank you. Thank you so much for your time. So
You're
this
welcome.
there you have it. Physio Shion has given us insight on how to prevent, how to manage back pain. Movement is very paramount. Also, you don't have to wait till it is limiting before you see a professional, preferably a physiotherapist to assess you and advise you further. So that will be all for on today's episode of Pulse of Wellness. Join us for the next episode if you like this. Please comment and share, and please subscribe to our YouTube channel so that we can be able to bring to you other aspects of pain management, fitness, and nutrition. Thank you. Thank you.
Thank you for having me at Pulse of Wellness. Thank you so much. This is a really great incentive, and I'm so proud of what you're doing for the community. Thank you so much for having me.
Thank you again. Bye.
Bye.
Subscription matters, guys. Please subscribe to my YouTube channel so I can bring you more content on how to live pain free, healthier, and a more vibrant you.